In today's video, we're going to take a deep dive into an important and often misunderstood topic: depression. From its subtle early signs to the best strategies for managing it, we'll cover everything you need to know about depression. Let's start with the basics. What exactly is depression? Depression is a mental health disorder characterized by persistent feelings of sadness, hopelessness, and a lack of interest in activities that were once enjoyable. It's more than just feeling down or having a bad day. It's a serious condition that can affect every aspect of a person's life. Depression doesn't just affect your emotions, it can also impact your brain chemistry. Depression is often linked to an imbalance of neurotransmitters, which are chemicals that help regulate mood. Specifically, serotonin, dopamine, and norepinephrine are the key players. When these chemicals are out of balance, it can lead to the emotional and physical symptoms of depression. Depression is not one size fits all. There are different types of depression that affect people in different ways. The most common form is major depressive disorder, which involves a persistent feeling of sadness or a lack of interest in life for at least 2 weeks. Other forms include: first, there is persistent depressive disorder, also known as dysthymia. This is a long-term form of depression that lasts for at least 2 years. Next, we have bipolar disorder, where episodes of depression alternate with periods of mania or elevated mood. Another type is seasonal affective disorder, which occurs at specific times of the year, typically in winter. Lastly, postpartum depression is experienced by some women after childbirth. There's no single cause of depression. Rather, it usually results from a combination of factors. To start, genetics play a significant role. If depression runs in your family, you may be more likely to experience it yourself. Moving on, brain chemistry is another factor. As mentioned earlier, imbalances in brain chemicals can contribute to the development of depression. Additionally, life events can be a major trigger. Traumatic or stressful experiences, such as losing a loved one, facing financial difficulties, or dealing with relationship issues, can lead to depression. Furthermore, hormonal changes can increase the risk of depression. This is particularly true during periods like puberty, pregnancy, or menopause, when hormone levels fluctuate. Finally, chronic illnesses can also be a contributing factor. Long-term medical conditions like diabetes, heart disease, or cancer can sometimes lead to feelings of depression. Depression can look different for everyone, but there are some common signs to watch out for: persistent sadness or a low mood, loss of interest in activities that were once enjoyable, fatigue or lack of energy, difficulty concentrating or making decisions, feelings of guilt or worthlessness, changes in sleep patterns, either insomnia or oversleeping, appetite changes, leading to weight loss or gain, thoughts of death or suicide. If you notice these symptoms in yourself or someone you know, it's important to seek help from a professional. Depression is usually diagnosed through a clinical interview with a mental health professional. They'll ask about your symptoms, medical history, and any family history of mental health issues. Sometimes doctors may run tests to rule out other conditions that could be causing the symptoms, like thyroid problems or vitamin deficiencies. Typically, a diagnosis of major depressive disorder is made if the symptoms persist for at least 2 weeks and interfere with daily life. Early diagnosis is key to managing depression effectively. There's no one-size-fits-all treatment for depression, but there are several effective options. These include: cognitive behavioral therapy is one of the most common forms of talk therapy used to treat depression. It helps you identify negative thought patterns and develop healthier ways of thinking. When cognitive behavioral therapy is not adequate, antidepressants like selective serotonin reuptake inhibitors can help balance brain chemicals and relieve symptoms. It's important to note that medication isn't an instant fix. It can take several weeks to see improvements. Regular exercise, maintaining a healthy diet, getting enough sleep, and reducing stress can also help improve mood and energy levels. Further, mindfulness-based techniques can help reduce stress and improve emotional regulation. Connecting with friends, family, or support groups is essential. They can provide emotional support and reduce feelings of isolation. Managing depression is an ongoing process. It's not something that disappears overnight. It requires continuous effort. Some strategies for long-term management include sticking to a treatment plan. Whether it's therapy, medication, or lifestyle changes, consistency is key. Monitoring your mood journaling or using mood tracking apps can help you identify patterns and triggers. Practicing self-care. Prioritize activities that promote mental well-being, like walking outdoors, journaling, or practicing relaxation techniques. Being patient, recovery can be slow and setbacks are normal. The important thing is to keep moving forward. One of the biggest challenges in dealing with depression is the stigma that surrounds it. Many people feel ashamed or embarrassed about their condition, which prevents them from seeking help. Remember, depression is a medical condition, just like any other illness, and it's nothing to be ashamed of. By talking openly about mental health and supporting those who are struggling, we can break down the stigma and encourage more people to seek the help they need. It's important to recognize when professional help is needed. If you or someone you know is experiencing thoughts of self-harm or suicide, it's crucial to seek help immediately. Don't hesitate to reach out to a mental health professional, a trusted friend, or a family member. Therapy, counseling, and medication can make a significant difference in managing depression and improving quality of life. Depression can be a difficult and overwhelming experience, but with the right treatment and support, it's possible to manage and even overcome. Remember, recovery is a process that requires time, patience, and effort. And if you or someone you know is struggling, don't hesitate to reach out for help. Thanks for watching this video. If you found this information helpful, be sure to like and subscribe for more informative health and wellness videos. And as always, feel free to share your thoughts and experiences in the comments below. Until next time, take care and be kind to yourself.